I'm Cindy Peterson. I'm a Vice President, Chief Information Officer at Henry Mayo Newhall Hospital. We're a 238-bed community hospital, and so we do all services for the hospital, emergency. We have a very large emergency room, about 67,000 outpatient visits a year, so very, very fast-paced trauma center. And then we pretty much have all the other acute services, cardiac cath, NICU, ICU, that most have. We're a growing hospital. We're adding on 120 additional beds in a tower, so we're in the process of building out the facility to grow with the community. So we started with a couple early projects and products of Summit. The first one was scripting, and we utilized that when we first started rolling out Meditech in 2007. And then, our relationship with Summit continued to, evolve. And, and I was looking in the market for, a product that could really tie us closer together with our clinicians and physicians, and and as I talked to Summit's like, hey, that sounds like a pretty good idea. And so then we looked at the other products Summit had, and before you knew it, we evolved with exchange and downtime reporting, and then from there we really moved into the development of this new product. The product provides us the ability to make sure that we have authentication for all the staff that are going to be utilizing the system, and also to make sure that those staff members have access only to the information they should see, right? So we want to make sure if a physician's office, they have 20 patients, that their staff is only looking at records for 20 patients. And we already, in the first 3 days, we had 120 different people sign up for this product because they could see already all the information they needed for face sheets, for reports, and so they didn't have to call and get HIM on the phone to fax them over medical records. They could get the information and documentation directly themselves, which streamlined their workflow. From our aspect, the security part of it is huge, to make sure, with all HIPAA regulations, to make sure that the staff is only accessing the information that they should be accessing, and not every patient. So that was, and everything is auditable. So for example, if a physician can refer information to another physician that is not a medical staff member of our hospital, and they can refer that information and they can get it out, and we call it break the glass. And so it's auditable. So we know that this ex-physician got in to look at this record, and we know that it was referred from another physician. So those are all security elements that really have a huge impact. The other aspect is, I think, with the health information management, it has drastically reduced the number of phone calls for faxes and for information. So they're not having to go, find the record, print the record out, fax the information, and so that has really streamlined their workflow. So already we've seen a huge impact there. I think that the relationship with Summit is very sustainable. They've been, throughout this whole process, a great partner. I consider them a partner, not a vendor. And I really think that it's a journey we've been on, and I see us continuing that journey for the years to come. I see us continuing to evolve the product and continuing to implement the products that Summit Health has.